How does patient-surgeon communication set realistic expectations? Imagine planning a trip and talking with your travel agent about what you want to see and do. That's similar to how a patient and surgeon communicate before plastic surgery. Clear, honest conversations are key to making sure everyone is on the same page about what can and cannot be achieved. During the consultation, the surgeon listens carefully to understand the patient's desires, motivations, and concerns. The patient, in turn, learns what the procedure realistically offers, including the benefits and limitations. This open dialogue helps prevent misunderstandings and sets a foundation for satisfaction. One important part of this communication is discussing the patient's goals. Patients often have specific ideas influenced by social media or photos they see online. Sometimes these images are digitally altered, which can create unrealistic expectations. Surgeons use visual aids like before and after photos or computer simulations to help patients see what is achievable. This way, patients can express their true desires, and surgeons can assess if those goals are realistic. Educating patients about what surgery can realistically accomplish is another vital aspect. Surgeons explain the expected physical changes, recovery times, and possible risks or complications. They clarify that results may take time to fully develop and that some imperfections might remain. Providing this information helps patients understand the full picture, making their expectations more balanced and informed. Shared decision-making is also essential. Patients are encouraged to ask questions about the procedure, possible outcomes, and alternatives. Surgeons listen carefully and offer personalized advice, ensuring the patient feels involved in the process. When patients participate actively, they are more likely to accept realistic results and feel satisfied with their choices. In today's digital age, social media influences how people view beauty. Some patients may desire to look like digitally enhanced images, which is unrealistic. Surgeons address these influences by discussing the psychological aspects and guiding patients toward healthy, achievable goals. This helps prevent disappointment and promotes a positive outlook. Building trust through empathy is another cornerstone. When surgeons listen attentively and validate patient concerns, it creates a safe space for honest dialogue. Patients who feel understood are more open about their expectations and more receptive to professional guidance. Many surgeons also use imaging technology during consultations. These tools can simulate potential results, giving patients a visual preview of what is possible. Seeing a realistic image helps bridge the gap between hope and reality, making expectations clearer. Finally, encouraging questions and transparency is crucial. Surgeons invite patients to discuss what they believe is possible and to voice any concerns. This openness reduces misunderstandings and helps patients mentally prepare for their results. Overall, effective communication happens during the initial consultation and often continues through follow-up discussions. Patients should come prepared with clear goals, and surgeons must provide honest, detailed information. This ongoing, empathetic dialogue ensures that patients develop realistic expectations, which is essential for achieving satisfaction with their surgical journey and results. Remember, every individual is unique, and personalized advice from a qualified healthcare professional is always the best way to ensure safe and satisfying outcomes.